Hi, my name is Janice, and I'm Jane's assistant. We are going to tell you about our report. It is meconium aspiration syndrome causing persistent pulmonary hypertension with treatment of nitric oxide. First, what is meconium? It is the first intestinal discharge of the newborn infant and is composed of epithelial cells, fetal hair, mucus, and bile. Let's elaborate more about meconium aspiration syndrome. Intrauterine stress may cause in utero passage of meconium into amniotic fluid. The meconium-stained amniotic fluid may be aspirated by the fetus when gasping or deep breathing movements are stimulated by hypoxia and hypercapnia. The presence of meconium in amniotic fluid can be a warning signs of fetal distress. Mothers with meconium-stained amniotic fluid should be carefully monitored during labor. So, the meconium comes in chunks and very thick. If the baby aspirated, that's the problem. Here's the lungs, right and the left. Once the meconium passed at the large structure of trachea, while the meconium goes down, the structures become smaller and smaller to the smallest. Usually they're fine, but when days goes by, it plugs up the alveoli. Alveoli is the place where carbon dioxide and oxygen exchange. If there's poor exchange, it will cause hypoxemia, a decrease in oxygen in blood. Then as a result, goes to hypoxia, where tissues doesn't get oxygen. The alveoli at rest, the airway lumen is partially obstructed. And with inspiration, negative intrathoracic pressure opens the airway and relieves obstruction. Gas enters and expands the alveoli. During expiration, intrathoracic pressure changes the positive force, which narrows the airway and causes total occlusion. Gas cannot be expelled and is trapped with the alveoli. That's what we call a ball valve phenomenon. When hypoxia happens, lungs can't ventilate and oxygenate. That's why blood pressure goes up. We all know that in adult, blood circulation starts when the deoxygenated blood goes to venous system, right atrium and ventricle, pulmonary valve and artery, and to the lungs. Then it becomes oxygenated and goes to pulmonary veins, left atrium and ventricle, aortic valve and aorta, and to the body. In utero, babies have pulmonary hypertension because the lungs filled with fluid. Fetal gas exchange occurs through the placenta instead of the lungs. At birth, the baby's first breath will cause decrease in pulmonary vascular resistance and will increase in pulmonary blood flow and PaO2. Severe meconium aspiration will lead to persistent pulmonary hypertension. Persistent pulmonary hypertension, also known as persistent fetal circulation, is increased PVR, which leads to right-to-left shunting at the arterial or ductal level. The resultant decrease in pulmonary blood flow leads to hypoxemia. PPHN has primary PPHN, where there is classical PPHN, which is idiopathic. There is hypoxemia that develops in a baby with normal lungs, and breath sounds and chest X-ray are usually normal. Possible causes are chronic intrauterine hypoxia, asphyxia, maternal ingestion of prostaglandin, hypoglycemia, hypothermia, and maternal hypertension. Secondary PPHN is the PPHN secondary to lung disease. These are meconium aspiration syndrome, which is our topic right now, congenital diaphragmatic hernia, group B streptococcal pneumonia, respiratory distress syndrome, sepsis, and hypoplasia. Diagnosis for persistent pulmonary hypertension. hyperoxia test. It is to determine whether the patient's cyanosis is due to lung disease or a problem with blood circulation. Echocardiography is considered to be the most consistent non-invasive diagnostic test. Cardiac catheterization before was used to diagnose infants with PPHN, but now it's not recommended because it is traumatic to the baby. The most common condition that occurs as an underlying factor of persistent pulmonary hypertension is the meconium aspiration. Diagnoses for meconium aspiration syndrome are arterial blood gas levels usually reveal hypoxemia, respiratory alkalosis in mild cases, and respiratory acidosis for infant with severe disease. Chest X-ray typically reveals hyperinflation of the lung fields and flattened diagrams. In cardiac echocardiogram, pulmonary hypertension with the result of hypoxemia from right to left arterial and ductal shunt. Meconium aspiration syndrome causing persistent pulmonary hypertension can be life-threatening for the newborn. There are some treatments for this kind of disease. The treatments are supplemental oxygen, mechanical ventilation, high-frequency ventilation, surfactant, nitric oxide, and ECMO. Inhaled nitric oxide opens the arteries in the newborn's lungs and minimizes pulmonary hypertension. It works by opening up the closed blood vessels, and it also relaxes endothelial smooth muscles and dilates pulmonary arteries, which escalates pulmonary blood flow and rapidly advances oxygenation. I'm going to share with you a short video of my interview of one of the nicest neonatologists that works at Orange Park Medical Center.